Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Dr. Susan Kolb. She is a plastic surgeon in Atlanta. She has been board certified for over 30 years. She is the founder of Plasticos at plasticos.com, which is a holistic surgery center, and she is the author of The Naked Truth About Breast Implants. Welcome to the show, Dr. Kolb.
Thanks, Neil. Thanks for having me.
Well, let's get right into it. We don't like hanging about. Let's get as much information in this show as we possibly can from you. So tell me a little bit about yourself, how you got started with plastic surgery many years ago, and what kind of clients do you serve now?
Well, my main client base are patients that are injured by defective breast implants. And the overall view, I think, can be best understood by understanding that when a significant problem is going to occur, consciousness will also create the solution. So when I was in medical school, I was actually spiritually guided. I was born with spiritual sight and hearing. I was spiritually guided to become a plastic surgeon. And actually, I knew very little about plastic surgery, but I knew I was going to be a plastic surgeon. That was imprinted into me during meditation. And later on, I joined the military to pay for medical school. And basically, breast implants were free in the military. And I was also spiritually guided during meditation to get breast implants, and I probably would have never gotten them had they not been free. So I was guided to get Dow Corning silicone gel implants, not knowing that I was going to have problems with them, and not knowing that I was going to have a career helping women with problems with them. This is actually the story of the wounded healer that you've probably heard about. So I did get breast implants in 1985, and it was interesting. At the time, we were using Mentor implants or Higher-Schulte implants, so I had to go out of my way to get Dow Corning. Dow Corning actually had that class action lawsuit, which was the largest class action lawsuit in history, and because of that, because I was part of that, I got $27,000 in compensation, where I would have gotten about $3,000 had I used the other implants we were commonly using in the military. So this is a little bit about why it's important to follow your spiritual hearing. So basically, I got the implants. I didn't have any problems for about 8 years. And then the silicone started to leak out through the shell, which the Dow Corning engineering data says that it will in about 8 to 10 years. And because I have a detoxification defect, which is genetic, and about 30% of the population have some sort of detoxification defect, I became ill with a fibromyalgia and neurological disease. The interesting thing is that about 30 grams of silicone leaked out of my left implant, but very little leaked out of my right, so all of my symptoms were on my left side. Now, I had a choice. I got so ill that I could retire and go on disability, or I could figure out what was wrong. So I ended up getting my boards in integrative holistic medicine, which is about functional medicine as well as detoxification. There are about 30 different chemicals that are carcinogens and neurotoxins that start to leak out with the silicone. And so these need to be detoxed, as well as, of course, the implants and capsules, and any enlarged silicone-filled axillary lymph nodes need to be removed. Now, basically, no other person has figured out this, no other doctor has figured out this treatment protocol to include both surgery, medical treatment, as well as the detoxification process. Most patients have yeast and mold. 100% have yeast, and probably about 50% have mold. And this need to be treated with antifungals. They need immune and endocrine support. Their endocrine system is wiped out at the level of the hypothalamus, so they have adrenal, thyroid, sexual hormone problems, as well as ADH deficiency, so they drink and pee all the time. So basically, they become diagnosed with something called fibromyalgia, which according to regular medicine is unknown cause, and they stay sick for the rest of their life. This is really bad because they go on Social Security disability, and then they're not able to raise their families, they're not able to work, they become a burden to society, and this is all in a perfectly treatable illness if the medical field would only recognize that they're ill from their breast implants.
So how big a problem is this? You were talking back in 1985 when you got your implants, and it was about 8 years later. Was it all of a sudden because of new implants that we're using, or is this an ongoing problem still to today?
It's an ongoing problem until today. The implants used in the 1970s and into about 85 were very thin-shelled and leaked easily. However, Dow Corning created a low bleed implant in 85, and I actually got the low bleed implant, but it still leaked in about 8 years. So it doesn't matter. They haven't changed the shell significantly. They've textured the shell, and that caused problems with a rare form of lymphoma, which is actually due to mold biotoxins combined with the chemical toxicity. The texturing is not a good idea because it flakes off and gets in the lymphatic system. So this is silicone gel implants. They've made the inner gel harder. So for surgery, it's easier if it's ruptured. In other words, if I'm the surgeon, I go in and it sticks together, it's easy to get it out of the chest wall versus having runny silicone going everywhere. It's a real mess, and it gets on the floor and it gets very, very slippery. So silicone implants need to be changed out every 8 to 10 years according to the Dow Corning engineering data. This is not my personal opinion. This is according to engineering data. And so basically, when women are considering putting implants in, they need to consider this potential expense because a reimplant will cost $5,000 to $6,000 every 8 to 10 years, which is significant.
And what are the solutions now? I know they have the saline implants. Do they have some of the same issues?
They have different issues. Of course, the texturing, if there's any texturing on that saline implant, the silicone and chemical toxicity can be a problem. The texturing flakes off and clogs up the lymphatics, makes the lymph nodes enlarged in the axilla. They can get infected easily, and they can lead to the lymphoma. But basically, since I started removing the axillary lymph nodes that on any textured implant in 2005, I haven't had any more lymphoma occur after the explantation. Before, lymphoma was the most common cause of death in my patients. It didn't come right after the explantation, but within 10 years they were getting the lymphoma. So I figured it was better to get all the silicone out of those lymph nodes as well as take out the capsule completely. Most doctors do not understand this illness at all. There's a few holistic doctors that understand the toxic nature of the silicone and chemicals, but the surgical aspects are not understood by most doctors. They don't understand that in order to help prevent the illness from the silicone and then the lymphoma from the texturing, you have to remove all the traces of silicone from the chest wall and the axilla.
So give me a breakdown of some of the issues that women might have when they come to you. They know that something's wrong with their body. They believe that it is caused by the breast or a leaking implant. What kind of symptoms are they having, or should they look out for?
Well, on the silicone patients, they develop fibromyalgia, neurological problems. They have a lot of dizziness. They have a lot of numbness in their extremities. Say if they're ruptured on one side, that arm will be numb. Eventually, they can get muscular weakness, and many of them end up in wheelchairs. They also die earlier. There were 450 women and a local attorney here in Atlanta, and one of the nurses had a database because, of course, they had to keep track of all the women because 12 years later they got the payout from Dow Corning. And she told me that half of the women had died, and it was the half that hadn't seen me. So it is a disease that can be very deadly if not treated properly. And I don't think most doctors understand this. They die of infection because their immune system is impaired. They die of cancer because these women have a higher rate of cancer. And they die of suicide. And the suicide and cancer have both been documented in the peer-reviewed medical literature. Saline implants are a little bit different. Saline implants are usually pretty good unless they have a mold exposure. There's 25% of the population can't get rid of a mold biotoxin. So it doesn't have to be a mold infection. It can just be a contamination. And I've had people go on their honeymoon and scuba dive and get mold. I've had them be in a moldy building. I've had them be in a moldy car. And I've even had a woman who every time somebody hugged her, she had an anaphylactic reaction. And when we took her implants out, she had penicillamine, which is the mold that produces penicillin, inside her implant, and she was allergic to penicillin. So mold causes a fibromyalgia type condition. It's similar to the one with silicone, but it's got more neurological symptoms. Many of the women are misdiagnosed with MS and even started on MS drugs. MS is due to an intracellular spirochete, so that needs to be treated totally differently. And basically what we have to do for the saline women is take the capsule out, take the implants out. Usually, if they're smooth, we don't take any lymph nodes out because they're enlarged, but they're just enlarged because of mold. And then we have to treat with different antifungals for several months, rotating them. And then we have to do a biotoxin detox in order to remove the biotoxin from the body. The biotoxin is a neurotoxin. So if the woman has, say, mold in just her right breast implant, she will only have blurred vision in the right eye. If she has, it's interesting, if they have mold in their left breast implant, they'll have blurred vision in their left eye, but they'll also have arrhythmias because that neurotoxin goes through and causes arrhythmias of the heart. But they always go away after treatment. There's nothing inherently wrong with the heart. It's just the neurotoxins interfering with the conduction system.
It's amazing how the body works. But this seems to be a problem that has been going on for many years. Why isn't there a solution for this yet?
Well, it's because these issues are politically incorrect. The industry has spent a lot of money and a lot of effort to shut me up, for one thing. And the other thing is to have studies done at Harvard and Mayo and Duke that were inherently flawed, according to a group of epidemiologists at the NIH. They were trying to prove that silicone doesn't cause known autoimmune disease, which is true. It causes an unknown autoimmune disease. It's a different disease. So their studies are inherently flawed because you can't have epidemiological studies on a disease that's not yet been characterized. And so silicone is very politically incorrect. Mold is very politically incorrect. Most of the doctors I know that have published in mold have lost their medical license. And the industry and the government definitely do not want mold biotoxin disease to be a real thing, or it would affect their liability and the economy. Also, many of these patients, because of a T-cell immune deficiency, get intracellular infections like Lyme's disease, mycoplasma, other rare intracellular diseases. And because this is the basis of our biological warfare system, no studies are ever done on intracellular infections. So we have to treat the yeast, the mold, viruses, because that's T-cell immunity, parasites, and that people can get more easily when they have this immunity problem, and then intracellular infections, along with the chemical, silicone, biotoxicity, and then because so many people have detoxification problems, they usually come in with heavy metal toxicity as well. So I treat 4 different kinds of toxicity and 5 different kinds of infection, and then you add on to that bacterial infection, because they actually often get infected silicone in their chest wall and have pain that only responds to antibiotics. You have a very, very complex illness that most doctors can't wrap their head around. It's easier to say the patients are crazy, and that's what's said officially. The patients are just crazy. And they're put on SSRI inhibitors, they're put on Xanax, they're put on all sorts of things that they don't need. And basically, the medical profession has totally abandoned these women.
Well, that is certainly a shame to hear, and there's nothing like throwing more drugs and trying to sweep a problem under the rug. But how big is this problem? How many people out of all the people that get breast implants have these kinds of problems?
Well, in my experience, 25% of the women who get saline implants, it's basically one brand. The other brand doesn't have nearly as many problems because they don't have the valve problem. This one brand has 95% of the problem. Now, if the other brand of implant leaks and the woman doesn't get it changed out, then she can get mold, but that's really on her. So, but the other implant will leak, but it won't leak enough. The woman knows it's leaking. It will get mold inside it. She may not even have any chest wall symptoms. So it's very, very difficult for her to get diagnosed unless she goes online and actually researches. They'll actually type in the symptoms they have, and then, of course, the breast implant illness will come up. But this is not officially known by most doctors. Some holistic doctors are recognizing it now. But it's very difficult for these women to get help. And oftentimes their families are not supportive at all and don't want to help pay for them to get their implants out because they just can't believe that this is true, because there's so much official stuff on the internet saying that this isn't true.
So do you think it's a major concern? Would you advise people not to get breast implants?
No, there are some advantages to breast implants. Like, for example, if you have cancer and have mastectomy, if you put an implant in, there's 4-fold less risk of breast cancer. So that's a really good thing. So some people do test well for implants. I would avoid texturing in general. I would avoid silicone in most patients. Now, some patients test okay for silicone. And then I would, if you really need implants for cosmetic reasons or for breast asymmetry, I would recommend a smooth saline implant, the brand that doesn't have the valve problem, and then changing them out every 15 years. So that's not too bad on saline. It's better than 8 to 10. And I actually have breast implants now. I have Allergan smooth saline implants, and I think I'm going to be able to keep them for 15 years. I do avoid mold, of course, and I'm real sensitive to mold. So whenever I get in a mold environment, I get real bad fatigue, and I get blurred vision, and so I know if I'm in an environment with mold, and I get out of it, and I get I don't allow myself to get my implants infected.
So are there any other alternatives to saline or silicone? Is there anything going on in the future that might be a better solution?
Well, there's fat transfer. Of course, you have to have the fat, and it's actually better for things like breast asymmetry. It's really not going to take you from an A to a C cup that well, not unless you've just got a lot of fat, in which case you could do it, but it might take more than one operation. But fat transfer is safe. You will gain weight. When you gain weight, your breast will get bigger. If you lose weight, your breast will get smaller.
So tell me a little bit more about what you do at Plasticos. Tell me about the name Plasticos for a start.
Well, plasticos is the Greek name for plastic, and plastic means to mold. And so that's what we do. We mold, we treat illnesses, injury, a lot of injury. I was a hand surgeon for the last 25 years. Half my practice was hand surgery. We do a lot of facial trauma. We do burn surgery. We do scar revisions. We do cosmetic surgery, all the facial cosmetic surgery, body contouring, tummy tucks, all the breast surgeries, breast reconstruction, just a whole bunch. Now, I do have a particular practice right now in labiaplasty. A lot of women are symptomatic from having labia that are too large and rub, or having too much tissue around the clitoral hood, so that function of that organ is impaired. So we do surgery to reduce the tissue, and we get very good results in people not having the functional problems and having better orgasms.
Great. Well, tell me some of the plastic surgery. We've talked a lot about the breast implants and some of the issues that people have with breast implants, but what other things do they need to be wary of as far as a safety concern?
With plastic surgery in general, you need to make sure that you go to a board-certified plastic surgeon with experience in the area that you are interested. There are a lot of surgeons who are not plastic surgeons but are advertising as if they are plastic surgeons, and they don't have the training and the experience. And so like an OBGYN doctor can take a weekend course and open up a liposuction thing and just really not understand how to treat the complications of liposuction.
So many times you probably get to see the patients the second time round, they come to you for solutions.
They have to, because let's say if a dermatologist does the eyelid surgery, well, they're just not going to understand how to treat the complications. Or if an ENT doctor does breast implants, what if he gets into the chest wall cavity? He may have put chest tubes in before, but he's not trained in general surgery like we are usually. So, you've got to be able to treat the complications if you're going to do the surgery. Otherwise, the patient is really abandoned once the complication occurs, and then whatever doctor takes up for them is going to not be very happy that the original surgeon can't treat the complication.
So what is new in plastic surgery? What are the current trends? What are people having done now that might be different from, say, 5 years ago?
Well, there's a lot of non-surgical procedures, a lot of machines that use radio frequency, lasers, and other things. Like we used to do vaginoplasties in order to tighten the vagina up after childbirth. Now we can use laser or RF frequencies to do the same thing a lot more safely and without an actual surgery with general anesthesia. So I think the trend is toward things that are less invasive. There's a lot of different fillers. There's different solutions that don't require surgery. If you've got a huge amount of facial drooping, if you've got a huge problem with an overhang and weak abdominal muscles, you're going to have surgery. But I think that the future is very bright. I think that there are some things on the horizon that I've seen on the internet that may actually revolutionize plastic surgery. If people want to look up holographic medical beds, I think that will make a lot of things other than maybe removal of breast implants, which will still need to be done, obsolete. I think there's just going to, after disclosure, we're going to have a lot of medical technologies that will be absolutely mind-blowing.
Well, I love the fact that you not only perform all these different procedures in your office, but you really help people that are having problems that, they can't help. Maybe they went to a doctor a long time ago, or they had these breast implants that have started to leak, and you're really giving a solution to some major problems. Now, out of all the patients that you've seen in the last 30 years, is there anybody that springs to mind that just brings a smile to your face, or even just the biggest change that you've made in somebody's life because of the work that you have done? Tell me a little bit about the story, how they came to you, what problems did they have, what were you able to do for them, and ultimately how it changed their life. What was the outcome?
Well, probably the most spectacular surgery I did, it was a series of surgeries, but it was a ex-police officer who was driving to work with his wife early in the morning, and a drunk driver hit them. And he actually swerved the car so that he would take the hit, and half his face came off. He lost, he had his brain exposed. He had his nose completely off. You would not believe the shape of his face. And of course, he almost bled to death before we were able to control everything. But we were able to recreate his face with the help of the neurosurgeon. We took his skull off, took half of the skull bone off, put the other back on his skull, and used that bone to rebuild his face. And he's here in Atlanta. People can look him up. His name is Captain DUI. So he goes and educates. He educates high school students and others about the dangers of drunk driving.
Well, that's a quite remarkable story. It really is amazing what you can do with plastic surgery. And that's one of the things about choosing the right doctor, because it's not only a specialty that you've done a ton of education around, but it's also an art form.
Yeah, that's what I love about it. We sometimes have to get pictures and we have to create the nose back, or the eyelids might be missing. We have to actually use our skills to recreate what was there before the accident.
Well, we've covered a lot of information here today, especially about the breast implants and some of the problems that women might have with these silicone and saline implants. If there's anything else that you would like to talk about or leave our audience with, what might that be?
Well, a lot of my patients face a lot of, opposition from their doctors and their family and their significant others. I want to emphasize that we all have within us something called intuition. And intuition, if you follow it, will actually get you out of this mess of chronic illness. You may have to change your lifestyle. You may have to change your diet. You may have to change, a lot of the things that you do, but it will lead you to the right doctors, the right healthcare practitioners. Sometimes you just need a chiropractic adjustment. I've had people in chronic pain for 4 months after a car wreck. I sent them to a chiropractor, and after the first adjustment, they were out of pain. I think we all need to work together, but I want to remind everybody out there that you have an intuitive sense of what's wrong with you and who you need to go to get help.
Well, let's go a little bit into the holistic part of your practice. How does that come into play? Are there any special things that you do just that other doctors aren't doing?
Well, I actually have a company called Millennium Healthcare. It's probably the oldest holistic clinic in town. We have a family practice doctor, Dr. Brad Gould, who takes many insurances, which most holistic doctors don't do. We have a holistic chiropractor, Dr. Greenberg, who treats allergies and treats all sorts of other problems holistically. We have a classically trained homeopath, Dr. Nadia Danani, she's treated rashes that people have had for years. Rashes are often due to toxicity. When your liver and kidney quit being able to detox you, you break into a rash. Homeopathy is a great way to detox. So she gets all these wonderful results because she's able to practice homeopathy. We also have a natural apothecary. Instead of putting people on statins, we will treat the cause of the problem, and we will have more natural ways to bring your cholesterol and triglycerides down and treat it. Instead of just putting you on a blood pressure medicine for the rest of your life, we'll treat the cause of the problem, which is usually mercury toxicity. Do a mercury detox, get your fillings out that are defective, and you don't have blood pressure problems anymore. We believe in treating the cause of disease, and we use a lot of applied kinesiology and other holistic means to determine the cause of disease.
Well, I'm very much a believer in holistic medicine as well, and not putting any drugs in the body. It just seems such a massive problem in the United States, especially, that there's a pill for every problem. And there really usually is a very simple holistic solution.
When we were in the military, we used to, if we had a real problem, we just took them off all the medication, and it worked like a charm in most cases. And you have to remember, Neil, that prescription medicine, even if taken correctly, is the 4th leading cause of death in the U.S. You just can't combine all these medicines and expect good outcomes. I'm not talking about medicines like insulin or thyroid hormone or things that are replacing things that you need. I'm not talking about antibiotics or antifungals or antivirals that might be treating a very serious infection. I'm talking about not treating the cause of these chronic diseases. Cancer has definitely got specific causes. If you treat the cause of the cancer will go away. If you treat the cause of the high blood pressure, it will go away. And we need to start doing this rather than just supporting the pharmaceutical industry that really just wants to keep you on the drug for the rest of your life.
Yep, that's a whole other conversation right there that we could get into for hours, I'm sure.
I'm sure.
But, well, thank you, Dr. Susan Kolb, for being my guest on Business Authority Radio today. Tell our viewers, please, how they can get in touch with you. What's the best way for them to reach you?
Well, the office phone number is 770-457-4677. The website is www.plasticos.com. That's PLASTIKOS. And then Millennium Healthcare can be found under www.templeofhealth.ws. I also do a radio show every Saturday on BBS Radio. All of the radio shows are archived back to about 2011. And they're welcome to go on plasticos.com under resources and radio and see some of the holistic medicine, the spiritual medicine. And I've interviewed many, many whistleblowers. So I also have great interviews on what the powers that be don't want you to know.
Great. Well, there's been a wealth of information already in this show, but if you've got 7 years of episodes from every week, I'm sure there's all the information that anybody needs to know. So please go check that out. And again, Dr. Susan Kolb, thank you for being our guest on the Business Authority Radio. To our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
Thank you.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.